Medicare right now is a guaranteed benefit program. We all pay into it, and there's a benefit, Medicare. I pay into it every week, and when I retire, I am guaranteed a basic minimum and quite good set of healthcare benefits. Now, let's talk about what this means for current retirees, baby boomers, Gen X, and millennials. I have not spaced the board well. I apologize for that. So, the first thing is what we've already talked about, which is what is the impact? Well, they immediately lower the guaranteed benefit by approximately $11,000. In other words, in order to get what you're currently guaranteed as a senior, to get from this line to this line, you would have to pay $11,000 out of pocket. Now, we've talked about there are three major things that drive that. Prescription drug costs, which would go up, co-pays on preventative care and screening, and increased premiums, because for all of the bad-mouthing of the $718 billion, it's not taken out of the system. It's going after the cheaters and putting that into extending the system. And as anyone who's bothered to ever read about Medicare knows, premiums are based on the percentage of the overall cost. So by reducing the overall cost in Medicare, you keep premiums down. By putting that money back into those who are cheating the system, you actually put premiums up. So first thing is to reduce the overall benefit by $11,000. Then they create what's called a voucher system. And of all the things that Mitt Romney suddenly changed his position on the debate last week, one of the things that's interesting is he actually didn't back away from the voucherization of Medicare. He owned that. So the problem with the voucher is they have set the voucher not to the cost of the actual health care. So there's a gap that forms. So if you're a baby boomer, you have to cover out of pocket everything here to get back to the current benefit that you've already earned by paying into this every week of your working life, to the tune of about $60,000. It's actually $59,500 is in the report, but we're going to call it $60K. In order to get up to what you're currently guaranteed and have earned under the law. Now, maybe Governor Romney would make you a 47%er who's just taking off the system despite having paid into that your whole life. But $60,000. Now for me, I'm at the tail end, the youngest end. Yeah.
The $60,000 is over how many years?
This is over the course of your retirement. So
your
assuming,
whole retirement.
right, 65 out. Now this is just this. This isn't Social Security. This isn't other expenses. That basically 65 to life expectancy. That's right. Yeah.
I noticed that you put a taper on that. Is that because of inflation, or is?
Yeah, the other way you could draw the line is to say the voucher is a constant and the price of healthcare goes up. This has just worked better visually, but it's the same effect. And the issue is that both are saying, how do we get this line collapse? But the difference is this starts out by saying, well, you're guaranteed the benefit no matter what, and we're going to try to find cost savings. The other is to say, we're going to set the value and just hope to God that there's a way that you can close that gap. And they've said it's competition, but we've seen what's happened with that.
If there's no inflation, the line would be flat?
Well, it's not inflation. It's specifically the cost of healthcare inflation.
So if there's no inflation and no change in cost of healthcare, it would be the same for baby boomers, Generation X, and everything?
Correct. So the assumption over time is based on, so here, just quickly, and then I'll go back to that answer because it's very personal to me. I'm at the very young end of Generation X.
Now, what is Generation X? What is that?
Well, I'm 37, about to be 38, and I'm considered at the tail end of Generation X. So what is the generational?
Up to 55?
Is it?
Let's go to 1964.
64, 74, so,
Yeah.
all right, so we're talking about basically a sort of born in 64 or later. Millennials, I think, start in, I guess, like 75 forward, maybe close to 80. So basically, if you look in the chart, they don't use the titles, they just use the year you're born. The page is on page 9 of the report. So back to your question, what we've done is assumed cost of healthcare based on the projections of independent folks, including the Congressional Budget Office, which is nonpartisan, the Center for Medicare and Medicaid, and others, and have basically assumed that growth rate of cost versus the other. So again, we're doing best predictions we can out over that time period. And with the millennials, it ends up being about 320,000, depending where in the millennials you are. Now, the reason that's significant, I think, there are a lot of reasons, is it's very difficult for someone who's just out of college to be thinking about retirement and how they're going to pay for health care when they retire, and Medicare seems very distant and far away, which I think is part of what conservatives are counting on in offering this kind of proposal. But when you say to someone, when you say to me, hey, you're going to have to save up about $200,000 before you retire just to cover the gap between your voucher and the kind of Medicare benefits that are currently guaranteed. I'm on the very fortunate end of the economy right now, my education level, but I've still got student loans. I don't have a huge amount of equity, in my house. The idea of coming up with $200,000 before I retire is even scarier if you work in a physical profession, where the idea of just working a few extra years becomes scarier. So can we know with certainty whether it's going to be more like 140 or more like 280? We can't, but these are using the best projections of where the cost of healthcare will go. Now, part, again, of what was part of Obamacare, the healthcare reforms, was things like the medical home model and electronic medical records and other things that could potentially bend that cost curve. That's one of the hopes of the system, that would help reduce that cost and close that gap.